Hello everyone. Today we are having an overview about what is hypertension. I am Buddhesh Pandey, MPhil student at Lakshmi National Institute of Physical Education, and this project is initiated by the Department of Health Education for spreading the knowledge about major health issues occurring in India. This project is supervised by Dr. Brij Kishore Prasad, faculty member of Lakshmi National Institute of Physical Education. These are the contents for the topic. Hypertension. What is hypertension? Types of hypertension. Causes hypertension and its risk. Signs and symptoms. Preventions and treatment. Now moving further, hypertension as a medical entity really comes into being in the year of 1896 with the invention of curve-based sphygmomanometer by Scipio Rivarocci in 1896, which allowed blood pressure to be measured. Now we are going to know what is hypertension. Hypertension is abnormal high blood pressure. It is a common condition in which long-term forces of the blood against your artery walls is high enough that it can cause health problems. Blood pressure is determined both by the amount of blood that heart pumps and the amount of resistance to blood flow in the arteries. According to the classification of British Hypertension Society, these values are divided into some categories. In this, the blood pressure goes at optimal level is around 120 to 80. In normal, it goes up to 129 to 84. And high normal, it goes up to 139 to 89. At hypertension, in grade 1, it goes up to 159 to 99. In grade 2, blood pressure raises up to 179 to 109. In grade 3, it goes above 180 and more than 110. Now, what are the types of hypertension? The first one is primary hypertension. It is also known as essential hypertension. Is the most common type of high blood pressure for most people develops over time as they get older. The next one is secondary hypertension. In this type of high blood pressure is caused by other medical condition or use of certain medications. Now moving further, what are the main causes of hypertension? The first one is genetic factor. It tends to run in families by shared environmental influence, still largely unidentified by genetic components. Fetal factors. Low birth weight may be due to fetal adaptation in intrauterine under the nutrition with long-term changes in blood vessels structure or the function of crucial hormonal system. Now, the next cause is environmental factor. Obesity. Fat people have higher blood pressure than thin people. Sleep disorders, breathing, often seen with obesity, may be an additional risk factor. Alcohol intake. Close relationship between the consumption of alcohol and blood pressure level, but small amount of alcohol seems to be beneficial. Stress. Chronic stress, uncertain. Acute pain or stress can raise blood pressure. The last factor comes under environmental factor is drugs. Oral contraceptive containing estrogens, anabolic steroids, corticosteroids. These are the medicines that increases our blood pressure. Now these are the some stats regarding hypertension and its risk. Leading causes of the global burden of diseases. Approximately 7.6 million deaths and total 92 million disability adjusted life year worldwide. Double the risk of cardiovascular diseases often is associated with additional cardiovascular disease risk factor, but large segments of the hypertensive population are either untreated or inadequately treated. Hypertension having some signs and symptoms. It is diagnosed through repeat blood pressure reading. Primary hypertension does not have symptoms other than high blood pressure. In secondary hypertension, most likely caused by renal disorders, symptoms you will see decreased urine formation, increased sodium and water retention. After signs and symptoms, they are having some preventions. The first one is lifestyle changes, having a regular checkup with your physician. Education, being aware of your blood pressure and where it should be taken. Understanding your personal risk factors. Engaging in community health awareness activities. If you are suffering from hypertension, then there are some treatments in steps. In step 1, lifestyle modification, diet and exercise, limit alcohol and tobacco use, reduce stress factor. In step 2, if lifestyle changes are not enough, drug therapy will be introduced. In step 3, if previous steps don't work, drug dose or type will be changed or another drug is added. In step 4, more medications are added until the blood pressure is to be controlled. Now this is all about hypertension. Is your blood pressure is in your control? Then like this video and be health conscious in your life. Thank you.